Governor Mike DeWine is about to begin his daily briefing on the coronavirus in Ohio. As of today, there are 5,836 cases and 1,755 people have been hospitalized. Let's listen in.
Continue our tradition of honoring Ohio universities. I have the University of Cincinnati tie on today. I asked Fran to come in and share with you some of the things that she's been doing. Fran?
Well, mostly what I've been doing is staying home like most of you, but I have been making some face masks too, and I've had kind of fun. As we walked in, you saw our face masks that we wore. I made that one. And last night, I decided, since I was doing more cooking than usual, that I had to make an apron to match it. So I have an apron to match my face mask. So that's my fashion statement for today. And I thought what would be good is, because we're trying to teach our children to be safe as well, I made face masks for all my little grandkids. And some of them are, even little Tad, who's just 1.5 years, I made this little tiny one for him with some elastic on the back. So anyway, that's Tad's. I put up a couple of recipes, one for kids. I put up my recipe for sidewalk chalk paint. I know a lot of people have been doing beautiful work with sidewalk chalk, and it's hard to find it, and you don't want to go to the store and look for it. And so my recipe just uses cornstarch and water. It's a cup of cornstarch, a cup of water, and either kids paint with it or food coloring. And you can go out and paint the sidewalk. It's a great thing for kids to do outside. I'm also putting up my grandmother's whole wheat bread recipe. I usually don't make it because it takes a long time to make it, but since I'm home, it works out pretty well. And it uses a lot less yeast than normal bread because you put half the flour in, let it rise for a while, and that yeast grows, and then you put the other half in. So those are just a couple of the things that I'm doing at home. I made some face masks for friends. One friend said if I made him 5, he would give $500 to my favorite charity. So I said, if you'll give it to a food bank, I'll do it. So, I just think we really need to help these food banks and send them money because they really are feeding a lot of people today. Thank you.
We have in Ohio over 900,000 veterans, and we want to thank them for their service. We've also honored 900 veterans who are in the Veterans Hall of Fame. And the Veterans Hall of Fame, as you know, honors our veterans for what they do when they come home, what they do after the service. So we have a short video that Eric is going to show here. It's made by some of these Hall of Fame inductees. And they are paying tribute to our first responders. So all of us up here want to join them in thanking our first responders. Eric?
Hello. As a native Ohioan and retired Navy SEAL, I want to take a moment and say on behalf of Ohio veterans everywhere, we salute our medical professionals, first responders, essential personnel, and volunteers. You are fighting on the front lines. We appreciate your service and sacrifice to all the communities around this great state.
Fellow Ohioans, we need to stand together by staying away. Please, respect and follow the guidelines and the orders that are in effect.
We extend our appreciation to Governor DeWine, Lieutenant Governor Husted, and Dr. Amy Acton for their transparency, leadership, and bold decisions during this time.
We applaud Ohio businesses, large and small, for life-saving ingenuity, entrepreneurship, and for being nimble as the landscape changes daily.
On behalf of Ohio's 733,000 veterans, please know, we'll get through this.
As veterans, we fought for you. And now, it's our turn to say thank you for fighting for us.
We support you today, and we will support you tomorrow.
Let's all work to flatten the curve.
Stay home, save a life, stay safe.
We are Ohio. We are the United States of America. We're all in this together.
So we thank our veterans, we honor them, and we thank our first responders. I want to talk today about a change in CDC guidance that they have issued in how we report the coronavirus statistics. I learned about this morning, and Dr. Acton and I have talked about it, discussed it, and we really both feel that while we will follow the guidance and certainly understand the guidance, we want to make sure that we show data in a way that is very transparent to the people of the state of Ohio, and in a way that does allow people to make apples to apples type comparisons. So we're going to be reporting this in more detail, actually, than the new guidance requires. So let me kind of walk through about how this is going to work. And Dr. Acton, when she talks and gives her statistics, will explain it as well. But as a layperson, I'm going to give it a shot here. So the numbers that you will see today, I believe, will be under this new reporting system. On April 5th of this year, the Council of State and Territorial Epidemiologists, known as the CSTE, put forth new case surveillance recommendations. The CSTE is a national organization made up of member states and territories representing public health epidemiologists, scientists who study infectious diseases and their spread. The CSTE provides technical guidance and assistance to the states and to the federal partners, such as the Centers for Disease Control, the CDC. CDC has now recommended that states follow this. Up until now, before this change, the guidance allowed doctors to count as COVID-19 cases only those that had been confirmed by a laboratory test. Only those that had been confirmed by a laboratory test. So when you saw the numbers that Dr. Acton was reporting, that was only those cases. The new guidance was developed by a committee of state epidemiologists from Idaho, Alabama, Iowa, Hawaii, Michigan. Is now a formal recommendation from the Centers for Disease Control. It will include cases that meet the following criteria. And let me just say this, and I'll say it again. We're going to be reporting this, the old numbers, or what would have been the old numbers, the old method of coming up with these numbers. We're going to then report at the same time what comes under the new numbers. Then we're going to put the total. So those, anybody looking at those will be able to see that. And I want to go through and explain what the new number that you're going to be seeing there every day, what that actually represents. Quick tests, let me start with quick tests, that have determined the presence of COVID-19 antibodies in the blood. These are the rapid tests that will soon be coming to Ohio, where doctors can prick your finger, check your blood for antibodies, and have a result within minutes. Under the old guidelines, if they had not been changed, those tests would not have been reported positive. You would not have seen those numbers. So this is evolving. The science is evolving. The way of counting is evolving as well. So we would not have been allowed to count people, or would not have been told to count people, who test positive for antibodies that they had not, if they had not previously had a lab test confirming the presence of COVID-19. So this new method of testing will show up in the second number, and without this new guidance, it would not have shown up at all. Again, a new way of testing. This new number will also include the following. A person will be counted if there is clinical evidence and epidemiological evidence of the presence of COVID-19, and when there is no other likely diagnosis, even if there is no laboratory test. So in this case, no laboratory test, but there's clinical evidence and epidemiological evidence of the presence of COVID-19, and there's no other likely diagnosis. That will be the standard that the reporters will use. The reporters, the medical professional people. This means that doctors in hospitals or outpatient facilities may determine that someone has COVID-19 based on his or her symptoms, such as fever, cough, pneumonia, along with a history of possible exposure to a confirmed case. An example might be a person who had all of those symptoms, who was living in a nursing home that already had confirmed COVID-19 patients. Now, as we report our data moving forward for deaths, we'll have the following numbers. Confirmed deaths, which is under the old category, new CDC guidance deaths, and then we draw a line and we'll add the two together. By the way, the National Center for Health Statistics, which is part of the Centers for Disease Control, in their death reporting for COVID-19, it's my understanding, is now reporting probable deaths in those numbers. So what this new guidance enables all of us to do is to better track who has the virus currently and those who have had the virus, those who are recovered, those who are no longer a threat in passing it along to others. Using this guidance will be instrumental in helping us trace the spread of the disease and eventually isolate it to smaller pockets or areas so we can open things back up again. At the same time, it will allow us to target limited resources for a better public health response. So again, the way we are going to report this data is going to enable people to compare these numbers as they change, but people are going to know what each set of numbers actually represents. We think that for Ohio citizens, this is the best way to report this. We are going to follow what the CDC has said, and we will do that, but we will break those numbers out. Let me talk about some good news. We have this announcement. There are many Ohioans we've talked about who are on the front line who are really making a difference. Ohio food banks continue to provide Ohioans, Fran talked about the food banks, with the food and personal care items that they need. As I mentioned yesterday, Ohio companies are coming up with innovative ways to meet the needs of those working on the front lines of this crisis. And every day we're going to try to mention maybe one or two of these companies that are really making a difference. We had a list yesterday of the manufacturers, and we saw some of the things that they were doing. One of these groups is our distilleries. Who knew, huh? Our distilleries, who have stepped up and are now producing large quantities of hand sanitizer. Jobs Ohio has purchased more than 3,100 cases, totaling more than 1 million ounces of much-needed hand sanitizer from our Ohio distillers. distilleries and will be donating it to the Ohio Association of Food Banks. Shipments of the hand sanitizer are arriving at distribution centers this week and will be delivered to Ohio's 12 food banks next week and over the coming months as they need it. So we thank them for that. I want to thank the distillers and Jobs Ohio for helping the Ohio Association of Food Banks as they work to provide Ohio families with food and the other personal items, healthcare items that they need to stay healthy. Yesterday, I got a question about our food trucks. Food trucks, I know, are certainly a favorite of many of my grandchildren, our grandchildren, and they're can be quite a hit and provide some really great food. The question yesterday was about these food trucks at our rest areas and how this would help people who are driving, people who have to be driving, and certainly how it would help our truck drivers. Our rest areas certainly are not as crowded as they have been in the past, but it is important that our truck drivers and other essential personnel have access to hot meals as they get food and other essential items to our grocery stores. Truckers, I give a shout out to them. They're making a difference. They certainly are essential. Last week, the Federal Highway Administration announced that they would temporarily allow us to use these food trucks. Our Ohio Department of Transportation has created a new permit which will allow food vendors to sell food to truck drivers and other essential personnel stopping at the state's 86 rest areas. The permit is of no cost to the vendor and can be found on ODOT's website. And let me just give that. It is transportation.ohio.gov, transportation.ohio.gov. This is in addition to the regular vending machine service that is provided and has been provided for many years by Opportunities for Ohioans with Disabilities. Let me talk for a moment about Medicaid and some changes. Our goal in Ohio is to keep as many people as healthy as possible and to ensure those that get sick with COVID-19 that they get the treatment that they need. That certainly includes reducing barriers to care. Medicaid, the managed care plans, and My Care of Ohio plans have come together to remove some barriers for the members, those receiving Medicaid benefits during this difficult crisis. They have collaborated to maintain the health of individuals, to keep them out of the hospital and reduce undue strain on our healthcare system. These groups are trying to reduce the administrative requirements of physicians and others to give them more flexibility so that they can focus on safe patient care. More details will be available on coronavirus.ohio.gov or by calling COVID-19 call center at 1-833-4-ASK-ODH. But let me also give an overview of some of these changes. Medicaid has eased several pharmacy benefit restrictions as follows. Prior authorization will be bypassed for new prescriptions. Members will receive pharmacy benefits regardless of in-network or out-of-network provider status. Third, the threshold for refills on certain prescriptions will be relaxed. Number 4, pharmacists who dispense emergency refills without a prescription will be reimbursed. Number 5, pharmacies that dispense over-the-counter medication without a prescription will also be reimbursed. Member copays will be waived. This is for all prescriptions. And 90-day supplies on maintenance medications will be authorized. The managed care plans have already lifted prior authorization for all but a few services. This took effect on March 27th. Physicians and other providers without prior authorization by a managed care plan are using clinical judgment to determine if something is a medical necessity. Again, for further details, please check coronavirus.ohio.gov, coronavirus.ohio.gov, or call 1-833-4-ASK-ODH for more information. Let me now turn it over to the Lieutenant Governor. John?
Thank you very much, Governor. Some good news on this Good Friday that I wanted to share. Early this morning, I got a call from folks at Surgeries, which is a company up in Mentor, Ohio, and they let me know that they received FDA approval for small-scale N95 mask decontamination. So we know the large-scale things that Battelle is doing for us in Ohio. Surgeries received small-scale approval to do this. It's through their VPRO, which is vaporizing, which is a vaporizing hydrogen peroxide sterilizer. Easy for me to say. That's the technology that they use. Battelle can do up to 80,000 a day per machine, but these are smaller scale, smaller that can fit into a business healthcare facility. They do 10 masks in 28 minutes, and they have 100 of these machines across Ohio. So it's just another example of the Ohio innovators out there, the businesses who are stepping up and solving problems. The technology for this was developed right there in Mentor, Ohio at the Surgeries facility, and we thank our innovators and entrepreneurs and healthcare professionals who are really just solving problems every day out there, and it's fantastic news. Additionally, I wanted to say, you probably, if any of you have school-age children like Tina and I do, our children are at home doing, conducting school every day. Our daughters do it online, and it's worked out great. But yesterday I came home, and my daughter Katie had shown me a mask that she made for me. She went in my drawer and tore out some old T-shirts and just folded them over and made them. They did this as part of their 7th grade life skills class that Pam Meadows, their teacher, conducted for them. And these work great. So everybody has an old T-shirt laying around the house, and while they're not quite as fancy as the one that the First Lady has been able to develop, that's still pretty good for a 7th grader. And I really appreciate Katie and Pam Meadows, her teacher, and all the teachers out there who really are stepping up to make sure that education goes on and using even a difficult time period as a way to teach a new skill and to help all of us get through this. So thank you very much to Pam Meadows and to all the teachers out there that are doing great work. One of the things, the Governor and I do calls with mayors and business leaders and county commissioners and elected officials all the time, and one of them that I did this morning was with the transit authorities and the mayors of the cities where those transit authorities are operating. What we did working with Dr. Acton's Department of Health was to set out some protocols and some guidance on how they could make sure that the transit operations were as safe as they possibly could be for the people operating the transit authority, for the people who are riding on those buses or trains or the various tools that we have available for them. The one thing that the leaders of the transit authorities wanted me to remind folks is that the only people that are supposed to be out there are people who are doing essential business. And so make sure that if you're using the transit system, that you're out there doing essential business. There's no reason to bring people together in those spaces unnecessarily so. And they wanted me to emphasize that as a reminder to take into consideration the safety of the workers who are operating those and to be considerate to them as you're doing this. They're asking their customers to wear a mask. If you have, masks available and you're on the bus, they would like for you to wear a mask. We're working to provide all of the gear, the PPE that the bus drivers and the transit operators need, but they really did ask for the benefit of you, the other riders, and the people who work there that you use safe hygiene habits, only ride when necessary, and that you wear a mask if at all possible. So remember, we're all in this together, and to minimize the threat of spread, we can all take those precautions that help out. Also, really appreciate the interaction the Governor and I have had with businesses. We're hearing what your thoughts are during this time. Had a great call with businesses this morning where they shared with me some of the things that they're doing as essential businesses to keep their workplaces clean, also offering feedback that as we look to the future, how all businesses can do these kinds of things and how we need to source that and communicate that out there for the future. So we really appreciate the dialogue that we're having with you out there who are the essential businesses and the advice that you're providing back to us on how we can prepare that future where we're all being thoughtful and making sure we're taking the precautions to ensure that we don't have a reoccurrence or expand the spread as we look at these things down the road. Also, I got a call, had a couple of them, from farmers saying, are there restrictions on us under the essential business list? Goodness, no. Farmers are essential. Yeah, we need you out there to plant your crops and to make sure that we are prepared to keep the food supply chain humming. We are grateful for what you do, but in all circumstances, whether you're a farmer, manufacturer, whatever setting you're in, please practice safe workplace conditions. And we thank all the farmers out there and everybody in that food supply chain that are doing what they need to keep us well fed and well supplied as we get through this difficult time period in our state's history. And then finally, job postings for these essential businesses. We now have 614 employers who are not only essential, but we describe them as critical to what we're doing to keep things humming in our state. There are 38,000 jobs that have been posted out there from whether it's healthcare facilities, manufacturers, food supply chain, of workers that they need, people to go to work to help keep this going. And that is at coronavirus.ohio.gov/job search. So over this weekend, if you have some time and you might be able to contribute to the workforce, please do so. Please go there and look at the jobs that are available. We would really value everybody who can participate in helping these businesses, if you could please do so. So on this Good Friday, I wish you all a peaceful weekend, and we thank you for the great job you're doing out across the state. We're flattening the curve, thanks to you, and God bless you all. Governor?
John, thank you very much. Dr. Acton.
Thank you. Thank you, Governor, and good afternoon to everyone. Let us begin with the numbers. So today, we are talking about total cases at 5,878, and our hospitalizations are a little bit above 1,750. And unfortunately, we have now seen 231 deaths in the state of Ohio from COVID-19. Next slide, please. A couple things I'd like to point out. We do know that we have tested about 58,000 in Ohio. We still have about 84 counties reporting at least one case. Our ICU admissions are still in the 9% range. Our hospitalizations right now are 30% of our cases because we know we're testing the sickest. Next slide. This is a new slide that we have on our website. Again, really trying to be as transparent as we can be and share with you the data as we have it. This was the dashboard I showed yesterday that's tracking a 5-day case average so we can start to see trends. Any one day we might see a slight fluctuation, but the data we're really concerned with here is starting to watch the trends. We know we're sort of flattening, and that flattening is by and large staying even. It might be flat for a long time, not a sharp peak to this. But what we really are looking forward to seeing is those numbers going down. And this gives you sort of a 5-day trend. Next slide. This slide actually shows hospitalizations, a little bit of detailed data. The mean age at hospitalization is 64, but as you can see here, on the age range from as young as under 19 and then going up by decade, you can see it's a bit skewed. So we are seeing people younger in the 40s, 30s, 20s, and a few that are in the 0 to 19 age that are hospitalized. We are, in our data overall of cases, seeing slightly more females, but something we've seen around the country, that hospitalizations, in this case 56%, are male. So it is, for various reasons that the science is still trying to elucidate, seeming to be worse scenario for males. Next slide. Does it forward? No more slides than that? Okay. So we have this in all data on our website. As the governor mentioned, we're starting a new dashboard that actually has the new CDC case definition in it. Just by way of background, case definitions by the CDC, which guide how states count cases, has been evolving since the beginning of this disease. It began very early on with a case being called someone who had traveled from Wuhan province. And then it expanded gradually to all of China, and then it expanded to additional countries, and then it expanded to the United States. So that definition continues to evolve with the understanding of this disease. But very importantly, the subtle changes that have occurred, as the governor said, are talking about expanded confirmed case definitions. So in the past, a confirmed case was from a test. That test being a special kind of test called a PCR test. That's the test that we've been talking about for the most part all along. Now there are some new testing technologies available. We still don't have them in any significant amount in Ohio. One is a rapid genetic test called the ID Now. That's an Abbott test or a few other brands. Those can do a rapid 2-hour, but it's still more like those PCR tests. Pretty soon, as the governor said, the test I'm waiting for are the antibody and antigen tests that are prick of the finger, versus anyone who's had this test knows what I'm talking about, or a flu test, the swab that you actually have go down your nose. And it's people who've had it know that that is not fun. Having a quick test that you can do blood on will help us rapidly diagnose people both with the disease and an antigen, and also people who have recovered from the disease. All of that data is so essential for us figuring out who now is no longer susceptible but has actually recovered. And as we know, we are all susceptible because this is a novel virus. So that new definition will be including the new types of testing that are now available, though I can tell you that is not really widely available in Ohio yet. What that did for us is change our case definition yesterday by about 17 cases. So it's still not a lot of numbers, but we want to be really clear with folks where we're getting our numbers as we move forward. And it also allows the diagnosis of cases in epidemiologic and clinical conditions. What that means is, for instance, in a nursing home, where we have very few tests available, once you've tested a couple of the nursing home residents and they clearly, in the old PCR test, have COVID-19, we can pretty much guarantee that every other case, if they're flu negative and no other respiratory disease, are basically a spread of that disease. So those very detailed clinical cases that have a tie to a very clear person who tested positive as their exposure is also counted. So we see the tip of the iceberg right now. We have to be very clear and transparent with you. All of these numbers are a gross underestimation of the amount of disease out there. Again, most people are mildly symptomatic. 25%, up to 25% may be asymptomatic or carrying it, and we have no way of knowing that they're doing that, and we're not really testing those folks with our very limited tests. So we know all these numbers are still the tip of the iceberg. We're seeing a little bit more of the tip of the iceberg with this new definition, but until we have full and available testing, we really won't know. The most important thing for us right now is to continue to follow trends, and that's why we share that data as well. And we'll keep sharing more as we know more. A couple other things I need to address. Essential and non-essential surgeries. This dates us a while back, but if you remember, we've limited the non-essential surgeries in Ohio both to free up capacity in our hospitals, but also because we have a severe shortage of the protective gear. So we're trying to use that for the surgeries that have to occur. Now, we've heard, the governor, lieutenant governor, I've all heard some anecdotal stories that sometimes there's confusion about what's essential and non-essential. This is very, very important. So I want you to hear this, both you at home as a patient who might need a surgery, and I want all our clinicians and doctors to hear this as well. It's really important that we know that here are the 4 criteria. It has to be a non-essential, and essential is based on a threat to a patient's life. If the surgery is not performed, that's one criteria. Threat of permanent dysfunction of an extremity or organ if the surgery was not performed. The risk of progression or worsening condition or disease, that's very important, or a risk of rapidly evolving symptoms. For you at home, and doctors, really, really make that clinical diagnosis and stay close to your patient. If they are in extreme pain from something they're experiencing, that changes the clinical condition. If you at home are having symptoms that are worsening, or if you are unsure about this, contact your doctor. And if you are still not sure after what you've heard, I want you to call the emergency room. I want you to go to the emergency room. You should not be having unremitting pain or change in your symptoms and just accept that diagnosis. So please take this seriously, doctors. If it's worsening, this is the difference. On an easy case, it's a melanoma that's spreading. Of course, that's essential. Cosmetic surgery is not essential, but there is a wide range in between there. And if somebody has extreme pain or worsening conditions, we need to reevaluate that patient. So let's look again, everyone, at essential and non-essential surgeries. Next, I'd like to show you a video. This is a video that's airing around our state, and what it does is show the difference in sort of a different way to help you understand about how we're slowing the spread of infection. This is all about something that scientists call the R0, or it's the number of reproduction. It goes back to what I told you about that exponential spread of disease. When we started this out, the R0 that is scientifically known, the spread of disease, is that one person quickly, in the span of 3 to 6 days, can infect 2 to 3 more people. So let's take a look at this video. So you'll probably want to watch that video again. The first time I saw it, I have to admit, it took me a second to understand. But it really has to do with that little bit of social distancing, the fact that we still are making all the difference in this. It's when we don't spread it to someone else, and that spread is often to 3 more someone else's. And there's a wonderful article about this in the Columbus Dispatch today. I really recommend people reading it. It's more about this reproduction number. So this R0 is what happens when there's a new virus and all of us are susceptible. And R0 takes into account how contagious a virus is. Well, we all know now that this virus is very, very contagious, much more contagious than the flu. How many susceptible people there are. In the beginning, all of us were susceptible, and over the course of time, more and more of us will catch it, more of us will recover, and we will go from someone who's infected, so susceptible, infected, or recovered. And it also has to do in this number of what we do to stop that spread. So the R0 for this was at first told to be 2.3. You want an R0, whenever an R0 or that spread number is above 1, it means that we're exponentially growing it. When you have an R0 of 2, it means that at first you have 100 people infected, but in 3 days you might have 200 people infected, and 3 days later you now have 400, and that goes on exponentially. But when that R0 is less than 1, that is actually happening in the reverse. You might have 100 people, but now they only spread it to 50 more instead of 200. And then the next doubling, they only spread it to 25 more. So that exponential goes in the opposite direction. And that's when we start to see a disease burn out, or really not, we break those chains of transmission. So the things that we have seen over the last 2 weeks, because of that spread, because that ping pong ball is not snapping off and spreading it to others, means that we have lowered that R0 as a guess, and this is an underestimate based on the amount we can test, to 1.21. We know those R0s are underestimates, but still, it shows that you in Ohio are slowing that spread. And the more and more we can do that, the more and more we can stop that rapid spread of disease. Finally, I want to say one last thing. This is a very special time of the year, and the holiday and the symbolism are not lost. I think it's very important to know we are sharing some great news, the great news in Ohio of what we have done to stop the spread of this disease and slow it down. But there's a very good David Brooks column. He's one of my favorite columnists, and he called it the pandemic of fear and agony. I think it's really important that we talk about what is optimistic and look to what is good, but I never want to deny for you, the honesty about the fear and the pain many of us are going through, from losses of jobs to things. And he said in his column, this is about our bravery, and I'm telling you, this weekend always at this holiday makes me think about it, and the vulnerability, and that we're still being brave in the face of things that make us afraid and anxious and vulnerable. So David Brooks said, I am reminded that this is a time to practice aggressive friendship with each other, to be the one who seeks out the lonely and the troubled. It is also true that character is formed in times like these. People see deeper into themselves. They bravely learn what their pain is teaching them, and they become wiser. They become softer as a result. So this is a very disruptive thing. A pandemic is not just disruptive in terms of deaths. It's disruptive in so many ways on a society. And I want you to continue to be vulnerable, and I know you're all being very brave. Keep reaching out to each other. Thank you.
Dr. Acton, thank you very much. We'll take questions.
Hello, it's Tara Morgan with ABC 6 News. I just had a question about, should this be seasonal, as it's been talked about in the national media? How do you talk about mitigation in terms of people who have stayed home and are not exposed and they're worried about catching it if we do have a second wave?
If we do have what?
A second wave of this later on, after we've gone over this curve and everything.
Take that.
Yes. Thank you so much. So we know that a vaccine is at least a year to a year and a half away. And so this is not a journey that ends just in this immediate future. We will still have large parts of our population that have not yet been exposed. That is why we absolutely need to scale up our testing capability in this country. Without that valuable tool, it really makes it a lot harder for us to be able to tell, first of all, if someone's had it and recovered, but it also is how we will be able to, once we're stabilized, our hospitals are built up, we have the PPE we need to handle the emergency responses. We have the PPE in our nursing homes, in our prisons, for our frontline responders and our EMS. When we have all of those things, then when we have a test and we see, it'll go back to the sort of beginning of this, our usual epidemiologic work. We will be able to catch a case right away, and then contact all the people who've been exposed to them, and that select group can quarantine. And we'll be able to be sure that the others have not been exposed. So we really need those tools to truly start to move out of the woods. Thank you.
Hi, Lacey Crisp from 10 TV. Question for the Lieutenant Governor. About those 1099 employees, other states have been able to get their procedures in order. The CARES Act now allows for states to start handing out unemployment to those who qualify. Is it possible that the state won't get those procedures in place in time before those hairstylists, barbers are back at work?
So, first of all, I was on a call with lieutenant governors from around the country last night, and not one of them was able to identify that they even had the guidance yet, let alone the system up. So I'm not saying that maybe that's not the information you have. I don't have any information that we've A, received the guidance, exactly how it's going to work, or B, that anyone has it up. So I would, if you have access to information that shows where that's happened, please send it my way, because I am unaware that any state has done that. But we are working with the private sector to build the system. And to the best of my knowledge, I think we're prepared to be, as a state, rolling this out as fast as anybody. So that's the information I have. I'm happy to go check and find out more information about that. But that's where it stands right now. But believe me, I feel the frustration that sometimes comes our way, because you see that somebody passes a bill and then you think that, well, that money's out there and we're just going to get it. But at this point, there is no distribution system. We're building that. The good news is for those folks is that to the moment that they were eligible for it, they will receive the benefit from that day forward. So that the actual payment may not get here for a while, but they can have the reassurance to know that's coming.
Jim Province with the Toledo Blade. A question for Dr. Acton. And this is a follow-up to the question about testing a few minutes ago. Until we have broad testing out there, when can an essential business today, such as a healthcare provider, know that it's safe to bring back a worker who has stayed home for 2 weeks, quarantined for 2 weeks, but doesn't have a test to prove that they are no longer contagious? When do we know they're not contagious?
Right. Well, the good news is there is guidance out there for essential workers, and that is actually expanding. It was originally intended for hospitals and nursing homes, but that is being expanded to other essential businesses. And my understanding is it will even be to things like grocery stores. But the guidance is subtle. Our hospitals haven't had to enact it fully yet. But if there is a situation where the healthcare workers, they're so overrun, they actually have guidance on clinical. So without the test, and that is the guidance I've mentioned before, that was you have to have had 3 days without a fever, without any, Tylenol or Advil or anything falsely keeping it down. And you have to have been 7 days at least from the onset of symptoms. And that really lets us know that your risk of infection is much less. And then there's also guidance about the PPE they're wearing to make sure then that they're not spreading. So there is some guidance that is especially for essential businesses, and that's being expanded. And then that guidance, as you can imagine the future, and we'll be talking next week a lot more about the kinds of things we'll need to sort of kind of gradually, responsibly start to move our world back to something that won't look exactly like normal until we have a vaccine, but certainly not what we're experiencing now. And that guidance will really continue to evolve and spread out. Thank you.
Thank you.
Hi, this is Jake Zuckerman from the Ohio Capitol Journal. This is for the governor. Hey. As of yesterday, 36 Ohio prison inmates have tested positive for the coronavirus. 32 tests are pending. 68 inmates are in isolation. 53 prison staff have tested positive, and 1 has died. We're hearing reports from inside prisons of shortages of PPE and sanitizer. Do you believe that inmates and prison workers are safe from the coronavirus?
Well, no one is safe from the coronavirus. What has happened is the director was able to, and her team, keep the virus out. Once the virus comes in, obviously in any kind of congregate setting, it's very dangerous. So we were very concerned about this. We have set up a special group to work on this. The director, I went through the other day and outlined all the things that the director had done, and they started taking temperature of members of the staff who were coming in, making sure anybody went home who had a high temperature, anybody who gave any symptoms. Been following all the right protocol. Now, what we have done in the last few days is are starting to surge in there more testing. So we will be completely testing some of these prisons, every prisoner, and that will much better able to determine who has it, who doesn't have it, how to segregate them, and how really to attack this. So new testing, widespread testing in any prison where the coronavirus, we have evidence the coronavirus is there. The other thing that we're doing as far as the personal protection equipment, we are surging that equipment in there as well. So this is something I take very seriously. We have a responsibility to the employees, TRC employees. We have responsibility to the prisoners who are in our care. And we will do everything that we can to try to keep them safe. We've also, as you know, started a procedure where some of the prisoners will be released early. We're waiting for the legislature. Will be meeting shortly, the committee, to make decisions in regard to that. So we are also looking at other potential inmates as far as the ability to possibly release them. So that is a work in progress. But whenever you have a congregate setting, we worry very, very much about it. And so our focus now, as we get more masks in, as we get more equipment in, we're going to focus that on wherever we find a hot spot, whether that hot spot is in a nursing home or whether that hot spot is in a prison. These are things that keep us awake at night. These are things that we worry about, and we are focused on it. That does not mean it won't spread. Does not mean we won't have more trouble. But we're doing absolutely everything that we can with the tools that we have, and we're trying to get, we've been pulling additional tools in. So on the COVID-19 masks, for example, some of those are directly going into the prison.
Did I hear you say that you're going to test every prisoner?
Yeah, we're going to test every prisoner.
Okay, thank you.
In those prisons where we have already determined it. And we've been working with our nursing homes in regard to how, when there is a problem, we surge in more resources in those nursing homes, because these are the two potential really places where things can unravel very quickly, just because of the way people live together.
So I have a bit of an update on the 1099 question that I got a little bit earlier. There are a couple of states who had these systems already established because they had hurricanes or things like that do have some form of this up. But the states that have not built those systems in the past are the ones that are having to start from scratch. So those are some of the challenges that states like Ohio are having.
Adrienne Robbins, NBC4, and my question's for either the governor or the lieutenant governor. We hear about these companies quickly getting FDA approval and how we're cutting through red tape to allow our companies to be innovative. Do you think when this is all over, we'll look back and realize a lot of the red tape that we put companies through probably isn't necessary? Or right now, are we just taking the necessary risk to cut that red tape?
Well, I think the answer is probably yes. But I think it's always a balance. And it's all, you weigh these things out. Fran was telling me that she watched a show on the polio vaccine. Something that we remember when we were kids and got shots, and that was rolled out pretty quickly. And there were some people concerned about that. But judgments had to be made, and they made the judgment then, instead of waiting 5 years or whatever it would have been, we need to get this out. And it turned out many lives obviously were saved because of that. So I think it's always a balance. I don't think there's any it's hard sometimes to weigh those things out. What we did with the FDA, for example, in regard to Battelle and the sterilization process, they checked all the boxes. They went through everything. They just crammed it together in a shorter period of time. But FDA, would have no business authorizing that procedure unless they were sure it was okay. So I think you're seeing things, when there's an emergency, human nature is you can get stuff done faster. And sometimes that's just the way human nature is. So I think it's always a balance, and we always have to be careful. We don't want to shove things through too quickly, but we're in a hurry because we got lives at stake.
Yeah,
thank you.
And understand that these were granted under an emergency use authorization. So it's not the standard procedure. They do have waivers for circumstances like this, and this is an appropriate time to. This is an emergency. This is when it needs to be done.
Thank you.
Hi, this is Molly Martinez with Spectrum News. My question is for all three of you, really. It's been months now that you all have been in a full sprint to get ahead of this pandemic. When the cameras are off, how are you guys holding up personally?
How am I doing, Fran?
How's Fran doing?
Yeah. So a week ago, one of our friends brought us a new puppy, and that's really helped a lot because we lost Teddy before Christmas, and now we have a new Springer. She's a 1.5 years old, and it's been good for Mike.
She's bonded to me, so I bonded to her, I guess. So yeah, we're doing okay. There are a lot of people out there who are watching this who have had a much rougher time, and certainly anybody who's got the virus has had a difficult time, and our first responders, what they have to deal with, and so, we're doing fine.
I can add, and then I'm sure Dr. Acton has some things that she will want to add to that, but I'm very blessed to have a great supportive wife and family, and I know I'm blessed with that. But honestly, every time I hear somebody complain, I always say, I know there are a lot of people out there who have it a lot worse than you do or I do, and I always think about them. I always think about what somebody who's really struggling has to deal with, and I just feel a sense of responsibility to do everything we can to serve them, and that's what public service is supposed to be about.
Thank you. It's kind of you to ask that question, and it is an honor to do this. It is a long haul. We work, you don't see behind the scenes. Every decision is so hard got, and they're working tirelessly, and our whole teams that you don't see are. But likewise, if I could just say to my husband at home, Eric, I love you, and you've just been so good. Again, to have the support you have makes all the difference, and my husband's just amazing. Thank you. Sorry.
Hello, my name is Susan. I'm with Hannah News. And I have two questions, one for the governor and the other for the lieutenant governor. The first, So how is the National Guard assistance going in the federal prison in Acton? And do you have any updates on any inmate deaths? And the second is, has the Dispute Resolution Commission convened? And if it has, what issues has it discussed?
Yeah, I apologize. I got the National Guard in regard to what? I heard National Guard.
Oh, the National Guard assistance in the federal prison in Acton.
That is going, look, it's going okay. That's a difficult situation there. Our folks, went in there for limited purposes, but it's going okay. But, it's a difficult situation. John, you want to take the other?
Sure. It's a great question. Dispute resolution. I know that they got organized this week. I don't have any information on what cases they have. We will check that out and we will get back to you.
Thank you.
Thank you.
Hi, this is Jessie Bulmer with the Cincinnati Enquirer. My question is probably for Dr. Acton, but perhaps the Lieutenant Governor as well. I guess, why have we not yet been able to have access to these finger prick or serological tests, and when can we expect to have access to them?
Some of them were just invented and approved by the FDA, again, through the emergency use authorization that the Lieutenant Governor said. And so the companies are rapidly trying to develop them and then get them on board. And that just, the scaling up in production is slow. For some of the other testing, there are a complicated set of reagents that have a global supply chain to those. They're proprietary in nature as well. So it's a complicated set of situations that has occurred, and again, greatly impacted by the fact that this is a global pandemic. Lieutenant Governor?
Yeah. Well, when I started making calls to these companies earlier in the week, there was only, I think as of last Sunday, there was only one that I'm aware of in the country that had been approved. There are some in the other countries that were doing it, but there was only one in America that had been approved for this, and we were one of the first calls that they had. And we're supposed to get 1,000 of those really soon. I don't know when that's going to be, but we're hopeful to get those soon. But when I talked with one of the companies and asked them what we could expect in terms of timing on this, what they said is, they said, look, our experience around the globe is this, that once you develop a test, everybody wants you to go fast and produce it. But you have to make sure that that test has the reliability that you need, because what you don't want to do is start and get out there and have a test that only works 70 or 80% of the time. Then you will have wasted your time. And so that's why it's a little slow in developing, because they need to validate it so that you can make sure that what you have has the reliability that you need to make sure that your efforts are actually have value. And so that's happening very fast. I think that feedback that I've had is that we are weeks away from this. I think that when you get to May, that's when it's going to really, that we really hope to have more of these on hand.
Thank you.
Good afternoon, Ben Schwartz with WCPO in Cincinnati. Lieutenant Governor Husted, we have been getting a lot of questions sent in to WCPO about people wondering about their unemployment claims. I know you've addressed a lot of these issues already, but one of our viewers wants me to ask about what advice you have for someone who's been having a lot of trouble getting their claim through ODJFS. This particular person has been in touch with their state representative and was told that their problem would be solved immediately, but has still made no progress. We know these are unprecedented times, but a lot of people are still struggling, and I just want to know if you have a message for someone like that who was told their problem would be solved but hasn't heard back.
Sure. Without knowing the specifics of their situation, it's a really difficult question to answer, because those questions come to me, and what do? I pose those same questions to the people who are running the system and Director Hall. And believe me, even as this news conference has gone on, I have been on the phone texting her and saying, what guidance, do you have on some of these things? And the feedback that I've received has been that for everybody who's applied and has been approved, that we're caught up. That's going out. But there are occasions when somebody may be contacting the folks at unemployment, and they don't have all the information they need to actually apply. And I know that can be frustrating, so that's why I would encourage folks, before you try to get through, go to the website and read everything that you're going to need to be able to provide them. Again, this system was not designed for these circumstances. The system is usually designed for checks and balances to make sure that somebody, doesn't try to take something from the system that they haven't earned. And so that's why those safeguards are put in place. But in a time like this, the safeguards can seem frustrating because it's like I have to have this and I have to have that. So go to the website, make sure you get all the information that you're going to need to apply, have that in place first, and then know that they're supposed to get back to you as quickly as they can if you have not, if you don't have what you need, so that they can help you get through that process. But it's very difficult to answer that specific question because I don't know what the holdup. We also know that there are some people who are applying who are not eligible. All of those kinds of things can lead to the frustration, and so I'm empathetic to what folks are going through. Every day we build more capacity, we build more problem-solving solutions into it, and I just ask that you are patient as we're building this out. I know that if you are in desperate need of those resources, that asking you to be patient is not good enough, but believe me, everything that I get from you, I'm taking to them and asking them to solve these problems.
Thank you.
Max Felby from the Columbus Dispatch. For the governor and Dr. Acton, as projections of the peak in coronavirus cases have changed this week, we've heard a lot from readers and other people around the state who are seeming to kind of doubt the initial threat from the virus. And I wanted to ask what kind of message you or Dr. Acton might have for some of those doubters out there.
Well, sure. Look, I understand what they're saying, but no one should doubt how deadly this is. You looked at the news last night or this morning, and the coffins and being buried in New York. If you recall what we saw on the news coming out of Italy. And despite the fact that when we go outside today, looks like just another spring day, we have your fellow Ohioans who are dying today. You have fellow Ohioans who are in intensive care. You have fellow Ohioans who are not able to breathe. So this is deadly. This is not a game. This is not something that, I woke up someday and decided I'm going to, impose these regulations on the state. Ohioans have done well. And when you talk about the modeling, they're projections of what might happen if certain things happen. Ohioans changed the outcome. And what we did is we did stay home by and large. We stopped school. We did many, many things that we're uncomfortable in doing, and we continue to do those. If we had not done that, we would be right now in the midst, heading right into the midst of what you saw on TV in Italy, what we've seen in New York. There's a reason that Ohio's numbers are a lot better than we projected, and a lot better, frankly, than other places. And that is because Ohio did this early. We were strong, and that made all the difference in the world. There are different alternative futures, and it depends on what you do today and what we do today. But no one should think that this thing is over. Any Ohioan who has not had this can get it. And there's some evidence that even people who've had it might be able to get it. I'll leave that to the scientists. So while we're going to work, one of the things we're working on this weekend, besides our budget, we're working on this weekend is, how we get back in. That's not going to happen overnight, and it's not going to happen by flipping a switch and everything's going to be back to normal. I wish I could do that. I wish the reality of life was that. So for those who doubt that, I just say, please be careful. It is out there. It is still among us. It is still killing your fellow Ohioans. And what we need to do is stay home. We need, this weekend, when families normally celebrate, we have to resist that pull, and we have to celebrate, virtually in any way that we can. Please be careful.
I have a little bit of information following up on the question about the Dispute Resolution Committee. Thankfully, that is all posted on our website at the coronavirus.ohio.gov website under the Dispute Resolution Commission. The advisory opinions there, or the meeting minutes are there, so all the information you need should be right there on the coronavirus.ohio.gov website. Thank you.
Hi, Julie Carr-Smythe at the Associated Press. This is a question about the modeling, kind of a follow-up to what you were just talking about. Maybe it's a little hard to understand, but it looks as if the modeling on the website right now says that the peak would have occurred on March 22nd without any mitigation. I think it's marked as unmitigated. But the stay-at-home order didn't go into effect until March 23rd. So I'm just trying to understand that picture, which you've been showing a lot, and I know that the numbers are always getting a little better, but it's a little confusing. Maybe that's for Dr. Acton.
I think I'd have to take a look at what you're talking about, because I think the unmitigated part, it would have peaked sooner. Actually, maybe that is what you're talking about, the one curve. So if we had done nothing, we would have seen a huge spike. I mean, that is the whole point, and that's what would have spiked quickly on our hospitals. It's what we saw happen in Washington originally. We see that, even though New York had a little time to prepare, they didn't have as much time as I think they would have liked. And so in Wuhan, it was the ultimate of that. They had no time to prepare. So that first curve is really, you'd get it over with, you'd have more people get infected quickly, you'd have far more deaths, and a hospital system that would have led to even more excess death because people wouldn't be able to get the care they need, which is probably happening in New York right now for the other things they really need to get in there. So there's so many confounding factors. By stretching it out, it goes longer.
Right.
There's no doubt about that. It's a controlled burn versus a wild burn. We're trying to slow burn it, and you're trying to find that sweet spot where you keep everything functioning. But the bottom line is, it's not just about the beds in the hospital right now. We don't have gear for routine surgeries. We have a shortage of medicines for using with ventilators. So it's a complicated scenario. It made the peak go out farther, and we're so flat. We're actually, when we say peak, we're not going to look very peaky. We're sort of a plateau, if that makes sense, and on this mountain, and then it will be a slower decline. But with each and every day we buy, we're more prepared in all our systems. And with each and every day we buy, there could be more PPE, there could be more testing, and it makes us better able to protect people and stop the spread. So this is the nature of a pandemic curve.
Right, but it's not your impression that somehow we were on the way down when some of these mitigation factors were added?
No, okay. That isn't my impression. And I also would say that that flatness, what we're going to see as trends, and I just want people at home to understand, you're going to see a lot of hospitalizations and deaths. Even when we're doing good things, it's all sort of following in time. Similarly, if we stop doing what we're doing, most of us are still not immune, and you will see, it will take 2 weeks, so you wouldn't see it right away. And my guess is, and as you watch around the world, places that go too quickly and remove these things too quickly, they see that spike. So just keep watching what's happening, and you'll see places having to go back around, like a Japan and others, and have to go back through what we're doing now. Doing what we do now well gets us the farthest. It helps us the most in economics and the most in saving lives. So we just have to do this part well, Ohio.
Thank you.
Yes.
This is Laura Hancock from Cleveland.com. I have a question for Lieutenant Governor Husted about unemployment. Hello. I am just wondering, there's a lot of people who are writing us and they're saying they're kind of in this bureaucratic no man's land. We understand that there's no backlog anymore, but what about the people who have like a hitch with their case? Is there, just like is there a way is there a phone number they could call or a particular, thing where they're stuck?
Yeah, there is a chat function on the website that allows you to do some of that interaction, and we hope that people are taking advantage of that. That's a great way to do it. Your question, we got a couple questions like this. What we need to do for you and what we need to do is to clear this up much better in terms of helping people understand what that is clearly. The website is supposed to supply that information to help you navigate it, but I know when people get frustrated that sometimes that may not seem like enough. We're expanding the call center so that you can talk to a live person. These things are being built out. I believe those services are available to help you navigate that. It's just that there are not enough of them right now to solve this problem. As we continue to add people to the unemployment comp system, we hope that we will clear through those things. But I always want to remind folks of this, that your benefits will be backdated to the point that you are eligible. So maybe you're not getting through the system but as quickly as you would like, but you can count on the fact that if you're eligible for it, you're going to get it.
Thank you.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. On the counting of these probable cases, how much weight, how much influence do you think the count of probable cases will have in future orders, future public policy? In other words, if we see a huge spike in probable cases, should we expect a dramatic shift in policy?
Look, we're always seeking as much information as we can. What you're looking for is whatever the trends are. And so, you're going to establish with the new numbers, the new category, you will establish in a few days where those numbers, what they look like, which way they're moving. And then you go from there and see where it goes from there. You're going to be doing the same thing on the numbers we're already counting and the way we're already counting them. So I think you're going to be looking at both. What you're really looking for always is trends, and which way is that trend line moving. And as Dr. Acton just said, going into this, it would appear that we're maybe going up a little bit, but we've really slowed that down. And so we may be at a plateau and then start back down. So I would not think that the new numbers would, when we can take those in connection with the old numbers and look at both of them at the same time, I would be surprised if they, tell us something different. But we'll have to see and kind of, judge that. But it's, you see the great irony, for example, of New York on the news at night, and they're celebrating that they've slowed this thing down, and yet it's a huge day for deaths. And then we have the same thing. I mean, we kind of blow by this, but we have people who are dying right now in Ohio, and we celebrate the fact that we're not going up like a rocket, but we have to mourn the fact that we're losing people, and that will unfortunately continue for a while.
Thank you.
Thanks, Andy.
Hi there, Molly Koick with WHIO. Our health commissioner in Montgomery County just said that parades need to stop because they're non-essential. Governor DeWine, can you speak to that?
Yeah, parades are not a good thing. Look, you can go back in history, and I know we've talked about this before, but when you go back 1918, the pandemic then, one of the things that Philadelphia got wrong was they went ahead and held this big war bond parade. They were in the midst of World War I. They had the parade. People look back on that and think that that was one of the main things they did wrong, is people coming together. When you have a parade, it's not just the people in the parade, it's people who are going to watch the parade. Somebody's got to watch the parade, so they're congregating on the side. So, I don't know the facts about the parade, but by and large, parades would not be something that, should be happening.
Thank you.
Hello, sir. Thank you very much for your leadership. This is Luis Gil from Ohio Latino TV. This question is for the Lieutenant Governor. If, as you explained already, governors, and about the unemployment and people trying to file on their phones, being busy, people are still frustrated, and they keep asking us to ask this question, is as the days go by, up to 3, 4, 5 days of calling constantly and not a single, answer, have you thought about perhaps spending a second shift and different hours? And the second question, what would this do to the unemployment premium for small business?
Well, first of all, they're training the capacity that the system, they're putting people on. We have, I think, 20 times, we're up to 1,000 people now who are working. They're working on everything from the phones to processing claims, adding people all the time. You can't, someone has to be trained to be able to do this. There's a process for following the federal and state laws to do this, and we've ramped up faster than I actually thought we even could. So that is happening. As far as processing claims, that has caught up. They are catching up on the capacity for the call-in system. It will be open. I don't know what the hours are over the Easter weekend, but they've been operating every weekend, including Saturdays and Sundays, and the online system is available 24 hours a day. And literally every single day, they're building more and more of that capacity. As I've said on several times today already, I am very empathetic to what's going on. Everything that I hear from you, everything that I hear from them is getting driven down into the system so that they know that they have to respond. I can tell you everybody who works at unemployment compensation gets the urgency of this. This is not like they're unaware of it, and they're building out that capacity as fast as they can. But I do want to put this in perspective, that when you see the unemployment numbers, there are more people that are applying for unemployment in 3 weeks than we typically have in years. It is, I guess in a month, we're having more in a month than we would see over the course of years. And the system just wasn't built for that. And so we're trying to build a system while serving people all at the same time.
Yeah, and thank you so much. Just people that are watching, they just wanna hear something maybe more specific. You know what I mean?
My message to them is that we hear you.
Yeah.
And we are acting, and we will get the benefits to you that you have earned.
And to the premiums, Your Honor, sir, the premiums, the unemployment premium, will that, after all this is over, is it going to affect the small business?
Well, there is no doubt that the unemployment compensation system is going to need action to shore it up in the long term. That is without a doubt. And
thank you very much.
How that's done is really a question that we will have to work with the legislature on.
Thank you.
Hello, Laura Bischoff, Dayton Daily News. I am a last question. Dr. Acton, could you explain how we're going to get to 1,600 new cases a day at the peak when we're only going up a couple hundred right now a day? I mean, is 1,600, is it still the number?
I think the modeling numbers will continue to adjust based on how well we're doing our social distancing and how rapidly this virus is spreading. So it's not an exact point in time. We're going to go back and look at that curve when we have data. But the number of cases, as we know, most of the cases that are out there, it's really important to point out, we're not counting. So even though we're counting this number of cases, 80% or more are not being tested. So most of the cases out there are outpatients being diagnosed clinically based on their symptoms, and they're staying at home. Even a good number of cases within nursing homes. Again, not every nursing home person is being tested. There's a couple tested and then they're assumed to have the same disease spreading. So that's a very important part of that.
Okay, and then I just had a quick follow-up for either Fran DeWine or the governor. In reporting, you always want to get the dog's name. Could you tell me the dog's name? Your new puppy?
Well, we haven't quite got there, but we're thinking about Dolly.
Dolly, okay. With a Y at the end or an IE?
Why?
Okay, thanks. Thank you.
We will not be holding a press conference tomorrow nor Sunday unless something comes up and we have necessity of communicating and talking about it and answering questions. So let's hope that does not occur. As I indicated, we'll be looking at the budget. We have to make some budget decisions very, very quickly. We're going to be working on that this weekend. We're also going to be working, as we indicated, on kind of how we come back as a state and what we do. So those will be the things that we'll be working on. Just really want to wish everyone a joyous weekend. Those who celebrate Easter, a joyous Easter. This is the time of the year when we celebrate rebirth, no matter what our faith. And it is a time of optimism. And so as we go through and continue to go through a difficult time and have many of our fellow Ohioans who are suffering, some of them are mourning their loved ones. Let's think about the future. Spring is that time when we think about the future. It's a time for us to rejoice in life. So we will get through this, and there will be better days ahead. So we wish you all a great weekend. Thank you very much.
You've been listening to Governor Mike DeWine briefing reporters about the coronavirus here in Ohio. He said new CDC reporting guidelines will better track who has COVID-19, who has recovered, and help trace the spread of the disease. Before, only cases confirmed by a lab could be counted. And now the count will include cases with clinical evidence like fever, cough, and exposure. Having said that, as of today, there are 5,878 cases of coronavirus. That is 366 more than yesterday. 1,755 people have been hospitalized. That's up 143 from Thursday. And 231 people have died. That's 18 more than yesterday. Dr. Amy Acton said all of these numbers, though, are a gross underestimation of the total number of cases because most people experience mild symptoms and have not been tested. The governor also said the state will soon begin testing inmates in prisons experiencing COVID-19 in order to stop or prevent it from becoming a hotspot. And then he said that the state is looking into releasing even more inmates. The governor announcing that there is a new permit that allows food trucks to sell food to truck drivers at rest stops. That has been an issue lately. And that Medicaid has eased several pharmacy benefit restrictions, which should make it easier for people to get their prescriptions. Dr. Acton also clarified the order regarding non-essential surgeries. She said there are 4 criteria for those essential surgeries. They look at a threat to a patient's life, threat of permanent dysfunction to limbs or organs, preventing the progression of disease, and rapidly evolving symptoms. She says patients should not suffer, and she urges doctors to take another look at the criteria.